Almost all people face various physical injuries and diseases during their lifetime. Sometimes a simple fall can damage our hands and feet, and sometimes more serious diseases can happen to us and even threaten our lives. Most people go to see a doctor to solve the problem quickly in such cases. Our minds can also suffer many damages and problems, just as our bodies do. In this video, we are going to talk about the concept of mental disorders. Many people may think that mental disorders or disturbances are too severe that patients need to be admitted to psychiatric hospitals, receive electroshock, and, in our everyday language, must be insane and weird. But every individual may suffer from mental disorders to a certain degree. A variety of definitions of mental disorders have been presented in the world of psychology and psychiatry. The Diagnostic and Statistical Manual of Mental Disorders, or in short, DSM, is one of the important and well-known references that defines and classifies mental disorders. This book was published by the American Psychiatric Association, and a new edition of it is published every few years. Mental disorders include a set of symptoms according to DSM's definition. All people anywhere in the world may experience these symptoms in different conditions and situations. But can we label people with a mental disorder just like that? Just having these symptoms per se does not indicate the existence of a disorder. Other criteria for diagnosing a disorder should be considered as well. One of them is the duration of symptoms. For example, one may have all symptoms of depression, but based on DSM, we cannot say they are suffering from a depressive disorder because this state needs to last continuously for at least 2 weeks, according to the definition. Additionally, a disorder, as its name suggests, must disrupt the job, social, emotional, or academic performance of the person in order to be called a mental disorder. Imagine a student who used to always get good grades in the university, and now they cannot study well anymore and have been suspended for a semester. This person clearly has problems with their academic performance. Or, for example, an employee who used to show up at work on time, but now they are constantly late, arguing with their colleagues, their motivation has decreased, and their work efficiency has dropped in general. Studying and acquiring awareness about mental disorders can be very useful for all people, but one symptom can be common among several disorders and mislead us in diagnosing the problem. So, when a problem comes up, do not label yourself as having a disorder or disease immediately, and leave the diagnosis to a mental health professional. Mental disorders arise for various reasons and may happen at any age and to any gender. Nowadays, we know that some disorders may be more common in women, some in men, some at early ages, and some at old ages. Factors such as genetics, unhealthy environment, unpleasant experiences, suffering from physical diseases, and many other factors play a role in causing mental disorders. Since many mental disorders are progressive, not taking action to cure their causes, the disorder to become chronic and more severe as time passes. Like depression, which seems to be a simple disorder. It is likely to be accompanied by other disorders if left uncured for years. The treatment process of mental disorders may take months or even years, but there are also some factors such as the presence of supportive family and friends, stable financial status, motivation to recover from the disorder, higher level of education, and a relatively high social status that can speed up the treatment process. Many people think that they can solve their mental problems on their own and avoid seeing a psychotherapist. As a result, they try different ways to improve their mood. Self-help books, exercising, traveling, lots of parties, arbitrary self-medication, participating in motivational conferences, or listening to encouraging talks, and many other measures can probably help us improve our mood, but these are only temporary fixes and act like painkillers. The problem still remains unsolved. Psychotherapists themselves may suffer from mental disorders too. They cannot cure their own disorder and must seek help from another specialist, just like an ophthalmologist who cannot operate on their own eye. All in all, some people may choose to live with their disorder for the rest of their lives, and they may never want to receive any treatment. The choice is theirs, but they need to be ready for a life full of tension and suffering for themselves and the people around them.